people use drugs. This is a fact, a very painful fact. But right now, at this precise moment, there is someone injecting filthy heroin in an alley. Someone is doing unthinkable things to obtain money to get the drugs. Right now, at this precise moment, we are not there. We are not helping.
Okay, I was a heroin addict for a number of years.
I became a drug user after I was raped.
Probably about 20 years of heroin addiction.
I couldn't control my feelings, so somebody introduced me to drugs.
I probably figured out I've injected myself about 25,000 times in my life.
I hid it really well. Like, not even my family knew I was using.
I just didn't decide one day that, hey, I think I'm going to become a heroin addict. I think I'll give up my family, my friends, everything I ever owned, all the life I made for myself. I think I'll give all that up and just, sleep in a cardboard box and inject heroin every day. It's not a conscious decision that I made.
I lost my job, I lost my place to live. I almost died. I had a 5% chance of living.
I didn't have a sense of community. I didn't care about anybody else. I cared about one thing, and one thing was to get my drug every day. And I realize now, it took me a lot of time and a lot of work to realize why I was behaving like that, why I was so self-destructive.
A couple of years ago, we had a report back from city staff where we actually asked the question, how much does addiction and homelessness cost the city of Vancouver? And we were finding that the city of Vancouver is spending somewhere around $27 million per year on the various programs.
Well, the street use of heroin carries considerable costs with it. I mean, there are costs to the individual in terms of sickness and in ill health.
They're doing it because of the black market in back alleys with shared needles. That puts them at risk of HIV/AIDS, hepatitis C, bacterial infections, abscesses in the heart.
They're quite frequent visitors to the emergency rooms and the inpatient beds of hospitals in the inner cities. Then there are significant costs to society in terms of sort of public disorder, where the public spaces become compromised by injection, drug use, used equipment, discarded needles and syringes.
Whether it was for housing, policing costs, needle sweeps, it's all been bundled together. Engineering, for example, just cleaning up the streets, things like that, costs a lot of money. And so clearly, we can save a lot of money in the city of Vancouver by really tackling this problem.
They also, for example, have to acquire the money to pay for heroin, and that often leads to criminal activity, to women having to sell their bodies for sex work, and so on.
So for the city of Vancouver, it's a substantial cost, and by taking care of folks, we can reduce it a lot. Certainly my research I've done over the few years at UBC looking at these populations has shown, for example, that there's a lot of abuse, sexual abuse, psychological abuse and things like that.
Developmental problems and childhood trauma, sexual abuse and neglect or violence in the family.
That's how they get into the cycle. They're introduced to things, and by using substances over time as a way of ameliorating their pain, they become addicted.
It's not about recreational drug use. It is about really a difficult situation, challenging situation in their life where they have to deal with mental challenges and where drug use is complicating an already very complicated life.
We go through life as a heroin addict being told every day how bad we are and how evil we are and how it's our fault that we're using drugs. And I think what happens then is we start to believe that.
What it does to the individual, it really reduces their sense of self. So if they had any kind of self-esteem, it's probably all destroyed now. Stigma is one of those things that, I think we see a lot of it in the city of Vancouver still.
We've had a treatment called methadone maintenance therapy for a number of decades, and this treatment can be quite effective for some people. But we do know there is a subgroup of people who do not fully benefit from methadone. So they either don't stay on it for very long, they continue to use heroin while they're on it, and in some folks there's a poor reputation of methadone as a treatment.
Even where you have optimal provided treatment in large, in large quantities of it, there's a non-trivial percentage of the people for whom this treatment does not work, or who do not or cannot engage in it and are repeat treatment failures.
Those people will not come forward for further treatment, so we're trying to find alternatives to offer this subgroup who are most adversely affected by addiction.
I can think of no other medical condition for which we only offer first-line treatment and don't offer second-line or third-line treatments if the first-line treatments are inadequate.